Hey y'all, can we talk? You Be the Cure is an organization I founded with the purpose of marrying my commitment to faith, human rights for all, and optimal public health. We are an organization that seeks to treat people and not just disease. Therefore, I'm sure it comes as no surprise that my favorite quote from the Reverend Dr. Martin Luther King Jr., a man of deep faith, is one about justice and health. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane, King said in Chicago at the Second National Convention of the Medical Committee for Human Rights, a group of American healthcare professionals that initially organized in June of 1964 to provide medical care for civil rights workers, community activists, and summer volunteers working in Mississippi during the Freedom Summer Project. There was no video, audio, or transcript of his speech when he spoke these words. In fact, they weren't words that he'd rehearsed, but thoughts that he'd offered during a press conference before his actual speech. As with even the most gifted orators, speaking off the cuff often leaves our words less eloquent, but more authentic. But this quote that I have internalized and the internet has immortalized, is in fact a victim of years and years of telephone. You know that game we used to play in class when we were younger where one person passes a message in secret to another person, and that person does the same until the message has made its way all around the class, only to learn that the original message has been refined and streamlined and sometimes distorted with every passing ear, resembling nothing close to the original message. What Dr. King actually said on that spring day in 1966, as reported on page 22 of the March 26 issue of the Oshkosh Daily Northwestern, under the headline, King Berates Medical Care Given to Negroes. And I quote, "We are concerned about the constant use of federal funds to support this most notorious expression of segregation. Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death. I see no alternative to direct action and creative nonviolence to raise the conscience of the nation." End quote. While what King actually said and what we remember may not seem different in meaning, they are, particularly around the word inhumane. King used inhuman instead. According to the dictionary, inhuman and inhumane have the same base meaning, cruel and insensitive, or lacking in compassion. But the dictionary goes on to further define inhuman as monstrous or barbaric. You see, they must be used in different contexts. Think of it this way. The opposite of inhumane is humane, or possessing compassion, kindness, or mercy. The opposite of inhuman, on the other hand, is human. To be inhuman means to lack all human qualities, not only compassion and kindness. To be less than human, as people of color have so long been categorized. To be likened to animals or 3/5 of a white man and therefore not entitled to the full scope of comprehensive care for our health and well-being. Make no mistake about it. While we celebrate the life and the legacy of a man who has long since spoken his last breath, the words of the Reverend Dr. Martin Luther King Jr. still ring true today. Of all the forms of inequality, injustice in health is the most shocking and the most inhuman. We saw it with Anarcha Westcott and the other mothers of gynecology who endured the abuses of Dr. J. Marion Sims. We saw it with Henrietta Lacks and the stolen legacy of her groundbreaking helicells. We saw it with Fannie Lou Hamer and the Mississippi appendectomies, and of course, the United States Public Health Service study of untreated syphilis in 600 Negro males in Tuskegee, Alabama. Inequality continues to fuel the HIV and AIDS pandemic in Black and brown communities, making it the greatest public health crisis of our lifetime. And injustice is the leading cause of death for people of color impacted by COVID-19. One of the ways I'm working to combat that injustice is through my work with the COVID-19 Prevention Network, which was established by the National Institute of Allergy and Infectious Diseases at the NIH. It brings together the infectious disease experts of research networks and global partners to prevent COVID-19 disease by rapidly and thoroughly evaluating United States government-sponsored COVID-19 vaccines and antibodies. Understanding the disproportionate effect of COVID-19 on Black, Latinx, and Native and Indigenous peoples, The COVID-19 Prevention Network has implemented a community engagement strategy that prioritizes the experiences of those at the margins and invites them to the table where decisions are being made about their health and well-being. As a CoVPN community engagement ambassador, my mandate is to connect with these communities of color in an effort to share the most current and factual information regarding COVID-19 and vaccines and antibodies being developed for its prevention. I believe that information and education are reparations for some of the inequalities that Black and brown people have and continue to experience as it relates to our health. And I'm committed to making that information accessible and comprehensible to everyday folks so that our consent to the proposed biomedical solutions to our problems are truly informed. In this case, it's the COVID-19 vaccine. Vaccine hesitancy is the highest among Black people out of all racial and ethnic groups. And given the legacy of medical abuse against Black bodies in this country, the skepticism is valid from a historical context. However, my hope is that with the right message from trusted messengers, we can liberate ourselves from the atrocities of the past so that we might move confidently into a healthier future, all while holding accountable the systems that we rely on to keep us well. We already know enough science to begin to end the COVID-19 pandemic as a public health crisis. What we need now, more than ever, is to treat people and not just disease. So as we celebrate a king today and continue to resist inequality and injustice and inhumanity in his honor, remember my favorite words from my dear Morehouse brother Martin, and remember them correctly. We all used to be somebody else. What's most important is that we're always working to be better today than we were yesterday. You be the cure you wish to see in the world. Peace and blessings.